Hi guys, Ryan here at the Covery. This is a quick overview of the features and benefits of the CryoSkin Revolution. We're also going to discuss the modalities that complement and enhance the treatment, as well as contraindication and client information. So get ready. The CryoSkin Revolution is revolutionizing the body contouring industry. It is a phenomenal tool to utilize in your spa. This is some of the table of contents. So we're going to do introduction, table of contents. What is the CryoSkin Revolution? The science behind the slimming, the science behind the toning, science behind cellulite and the facial, as well as foundational services that complement the treatment, premium services that complement and enhance the treatments, contraindications, client information, and I will address any questions that you might have at the end. So, what is the CryoSkin Revolution? So, it is a completely new concept. It is a multi-application platform incorporating manual and hands-free modes, offering a variety of procedures you can combine to obtain desirable results in both fat reduction, cellulite reduction, lymphatic drainage, skin tightening, skin rejuvenation, facials, pain management, etc. Now everything is possible with the CryoSkin Revolution. It is made in France and it's made with unmatched quality and technical performance. So there are three main settings. There is CryoSlim, CryoSlimming, CryoToning, and CryoLifting. So in the CryoSlimming session, it is a non-invasive procedure allowing to contour the silhouette by destroying locally the fat cells. It does this by inducing a thermal shock to the adipose tissue, typically going from 26 minutes to up to 45 minutes, depending on which mode we're working on, and it goes from hot to cold to hot. Usually it is recommended that you do a minimum of 5 treatments, and typically you start to really notice the change in the first 3 treatments. With the CryoSlimming sessions, you can do them once every 2 weeks, and you're typically looking after at losing about 4 inches after about 5 sessions. So now the cryotoning makes use of only the cold temperature to tone the skin, and it improves the local metabolism. It can be done on any part of the body, and it works in the long term by stimulating the production of collagen and elastin. It also helps to work at supporting the lymphatic drainage, and this can be done twice a week. So I do like to go back and forth between slimming and toning sessions, which is the protocol for the cellulite treatment. So 1 week you'll do slimming, 1 week toning, 1 week slimming, 1 week toning. Because I do find that in the body contouring world, the skin takes a little bit longer to bounce back. So by doing the toning sessions, you'll help to tighten up the skin between the fat slimming sessions. And then the third setting is going to be your CryoLift. So the CryoLift is your facials. This is a natural, non-invasive, anti-aging solution for the face and the neck. It is very effective at tightening the skin and redefining the face and lifting the skin off the neck. It does this again by inducing a long-lasting, deep biological reaction by stimulating the natural production of collagen and elastin. So it is a phenomenal tool, and it really helps to plump the skin up as well immediately following the treatment. So now I'm going to dive a little bit deeper into the science behind the CryoSlimming. It is a non-invasive procedure allowing us to contour the body by destroying the subcutaneous fat in the areas we've treated. It works incredibly well at destroying the stubborn fat areas. These are the body parts that clients might describe as being hard for people to lose with standard diet and exercise alone. You should notice a change immediately following its treatment, although there are times when you get really aggressive and you drop that skin temperature down close to -8, where they can cause an inflammatory response to happen, and they actually have a temporary swelling in the area that you just treated, so you might not notice quite as significant change immediately following the treatment, but you should notice a change from treatment to treatment to treatment. So one session will last approximately anywhere from 26 to 44 minutes, 45 minutes, depending on what body part you're running and what program you're running. So if you're using the static pads or if you're doing manual treatments. The slimming sessions, as I mentioned, should be done once every 2 weeks, with the last appointment set 2 weeks after the last treatment for final measurements. Packages of a minimum of 5 sessions are recommended. Some clients might need additional treatments, most clients will, to reach their end-term goals. But typically, for every 5 treatments they do, you'll typically see about a 5-inch loss. Of course, this is in combination with regular diet and exercise. So, an initial short, hot sequence creates a dilation of the fat cells, making them more receptive to the cold phase. So basically, it goes from hot to cold to hot again. The second sequence, as I said, it starts with a rapid drop in the temperature, causing the thermal shock based on the Perrier method. And you can go ahead and Google that. The adipose tissue crystallizes, leading to cell death or apoptosis of the fat cells, leaving the other tissues unharmed. This is a thermal shock that stimulates the lymphatic and blood to exchange in the treated area. So, and as I said, if you go and Google the Perrier method, you'll find that boiling water actually freezes faster than room temperature water because of that gas exchange, and that's underneath the same process that your adipose tissue is going through. So the final stage of the treatment uses, again, the hot temperature to reactivate the metabolism and encourage the drainage of the organic waste. This organic waste is caused by the breakdown of the killed fat cells, and that can take literally up to 2 weeks to eliminate. And this is done through the lymphatic system and the normal body processes. The science behind the cryotoning. So cryotoning makes use of only the cold setting to tone the skin and improve the local metabolism of the body part that we're treating. Procedures can be done on any body part for tightening effect on the skin. Cryotoning procedures can be used for post-baby belly, arms, cleavage, breast lifts. So the cold has an instant tightening effect, but the long-term effects is an increase in collagen and elastin production. Additionally, with the cryotoning settings, what happens is you'll help to stimulate the lymphatic drainage, so you'll have a fluid reduction as well, and you'll have an immediate reduction in the size of the area that we just treated. As I had mentioned earlier, the cryocellulite protocol combines both slimming and toning techniques. The cold destroys the fat cells, reducing the size of the adipocyte clusters, releasing the pressure on the skin, whereas the toning helps to massage, and it operates as a lymphatic drainage, which helps to flush out the fluids and toxins stored within the body. Therefore, the skin will appear smoother, and that orange peel aspect is reduced after doing several treatments. So now going into the science behind the cryofacials, the cryofacial is a natural, non-invasive anti-aging solution for the face and the neck. It is particularly efficient at tightening saggy skin and redefining the oval shape of the face and to lift the skin of the neck. And it does this by creating long-lasting, deep biological reaction, causing an increase in collagen and elasticin production, thereby rejuvenating the skin. A session typically takes 20 to 30 minutes, and results are immediate. It is recommended to be done one session every week for 5 weeks, and then once again, one session every month to maintain. So they can, in fact, be done once a day if you want to practice on yourself, or an employee or a family member. This plan has an cumulative effect, and it helps to maintain a higher production of collagen and elastin. These are only recommended protocols, as facials, as I said, can be done on a daily basis. The aging process slows down the metabolism, and cells absorb less nutrients. The collagen and elastin fibers break down, and the dermis loses elasticity, thereby favoring the appearance of wrinkles. Additional factors such as sun damage, pollution, and etc. can accelerate this process as well. So some foundational services that should enhance your results that you can use post CryoSkin treatments would be the biocharger, as it has recipes for lymphatic support, fat metabolism, wrinkle reduction, and skin support as well. Those would be my recommended recipes to utilize when doing either toning, facial, or slimming sessions. The Brain Tap is an amazing tool that can help retrain the brain for healthier habits, which helps to support efforts in reaching your body composition goals, especially when utilizing a slimming session. The red light therapy will also help to increase your ATP at a cellular level, resulting in a decrease in fine lines, wrinkles. Studies have also shown that it helps to stimulate adipocyte apoptosis, and you should have significant reduction in fat cells as well. So some of your premium services that can be combined to create a more personalized package for your clients based on their personal goals would be Balancer Pro, M-Shape Well, Hydrofacial. The Balancer Pro is a versatile, relaxing, and invigorating compression therapy technology that has been adopted from the proven principles of manual lymphatic drainage and more than 40 years of clinical research. The M-Shape Well is the most modern, non-invasive, focused electromagnetic induction system. It is safely toned, sculpts the muscles without exercise. It also contours the body by stimulating fat loss and reducing the volume in the treated area. The hydrofacials complement the cryofacials, as the hydrofacials will rejuvenate and protect your skin, all while providing immediate results and long-term benefits without any irritation. This nourishing and painless procedure is quick and easy, 3-step process of cleaning, exfoliation, and hydration. Some contraindications for the CryoSkin would be uncontrolled diabetes, pregnancy or breastfeeding, kidney disease, severe Raynaud's, cold-related disease, cardiovascular disease or lower limb ischemia, bacterial or viral infections of the skin. You do not want to use this if you have lots of acne breakouts that are open, because you don't want to spread the bacteria across the skin. Wound healing disorders, surgery in the past 6 months, any pacemakers or metal implants in the area, active or severe eczema, rashes, or dermatitis, any irremovable body piercings, open wounds or infected wounds, and active implanted devices or adjacent to the treatment area. So some client information. These are things that I like to remind my clients. I want them to remember that they should not be consuming any carbs 2 to 4 hours before and after a treatment. They want to limit the amount of alcohol consumed during this process. You also want to remind your clients that this works in conjunction with proper diet and exercise routine. And you need to also modulate and control their expectations. They're not going to have significant changes if they're not willing to put the work in on their end after they leave your spa. Remember that slimming sessions can be done once every 2 weeks, and toning sessions can be done up to twice a week. The cryofacials can be done every day, but maintenance should be done once a month, and the ideal protocol is you'd sell a package of 5. You would see them for once a week for the first 5 weeks, and then put them on a maintenance, or sell them another package until they get to the place where they want to be, where they want to start doing maintenance at that point versus corrective activities. So This is my contact information. If you have any questions or concerns, or you want to ask protocols, by all means, you can reach out to me via email or via text. I want to thank you very much for attending and for listening. If you have any questions, as I said, please reach out to me. Thank you again for your time, and I look forward to speaking with you soon.